I think for me, that's where my whole history started. I came back from my fellowship, and then suddenly I really focused on hip resurfacing, which is a different type of joint replacement, mostly in males and so on. But anyway, long and the short is it's a specific segment which you service in that case. But then I was trying to focus on young adult hips, and that's the typical ones I think your listeners tend to be the cohort of. And this is where suddenly I was the guy now, or we started basically in South Africa as a group of guys looking into this. And it was actually in 2003, I went to Bern, and there was this whole thing described as femoral-acetabular impingement. And what it means, basically, you have a cup and you have a ball. But the cup can change with certain things. You have either tight hamstrings or you have a hollow back. And then you can change it dynamically, or you go and do strange sports. I say you either have an abnormal hip in the way it's shaped that way, or the femur, which is not all the way around. So we know when people start training a little bit too early in the youth, that where the growth plate is not changed, you can get a full slip of the femur at the growth plate, or you can get a subtle one, depending on the load while you're still in your faster growing phase. So the shapes changes, and then you also have a genetic component. And that is now been described as a hip, or it's been described as a cause of arthritis. So now we know this can cause arthritis, and we can address that. We can pick it up, and then we can really prevent it.
So you want to prevent the arthritis?
Yes. So what's now happened is we has this hip arthroscopy in 2006 when I started. It was, what are you doing in the hip? So the first thing is to just understand that we can get into a hip, but a hip is a closed joint. So we let people sleep, and we can pull on that hip, get a centimeter space and work inside it and fix things, put sutures in and reshape the femur and the acetabulum. But understanding also address the soft tissues now around it. So we're not only working inside, we're now working outside, right around the hip now. And we can address clicking hips and all these things. So that's what I do a lot of.
So just for our listeners out there again, so what we're talking about is that you're a youngster, that a hip, there's a problem being picked up, and now they're putting a camera inside the hip and operating via camera. So 3 little holes, and you can actually see and work in there with tools. So and with that, it's minimally invasive. You actually don't have to dislocate the joint or anything like that.
Yes.
So obviously, later on in the disease with arthritis, they present with pain. But now we're talking of a client or patient that arise before they've got that disease. What type of symptoms do they come to you with? How do you, what do your typical patient, what do they complain about?
So there's a lot of times the people go to physiotherapists and all this, but I normally had a groin pain. I typically describe it as the C sign. So it means you try to grab your hip in the front and the back at the same time, but your hand is too small. That's a typical C sign. And then you can get this groin pain or the bum pain and stiffness. So you battle to put on your shoes and socks, stuff like that. And this pain is interesting. You have that type of patient, and then you also have the one with the soft tissue problems. Typical runners. I've got this typical segment of a runner, which is, they're fine. They can walk with you, they can do anything, but they're going to run, the next day they're painful. They go to the physio or bio or chiro, and the next moment they'll be treated for a psoas problem, hip flexor problem. The next moment, and then they will rest it. The next day, they will have a piriformis problem or a glute problem. So you've got 4 muscles around your hip, which is motors, which try to stabilize it. So if you've lost your suction in your hip, then one of these muscles sometimes get angry. And it is actually, those muscles can just last 25 minutes. So you typically see the fast runner, they get their pain around about 25, 30 minutes. It's about, depending on how fast you run, 4 kilos to 6 kilos. They typically like that, and then they can't run. And then they rest 2 days and they're fine again. And they go on like that for 2-3 months, but they don't get better. They do physio, everything, but they want to run. Just operated in the last month, 2 people who's done the Comrades earlier this year, typical thing. Because what happens is you stretch your capsule as well. So you tear your labrum first, and then you stretch your capsule. And that can all be repaired with this hip arthroscopy running again. I saw a girl this today, and she said, "Will I run again? Can I run?" I said, "Yes. I've got a really stout patient, and I don't think she's after the hip arthroscopy is won the Kona, which is the triathlete at 49 years of age. She then went on and injured it again, and we did the surgery again, and she won again the Kona at the age of 52.
Yeah.
So, and the Kona is the Hawaiian triathlon. It's the world championship. She is the world champion. So you can get back to that function. The problem is you have this groin pain which you nurse, and you get frustrated, but you can't get back to that sport. And previously, before we did the surgery, people couldn't detect it. We couldn't pick it up on MRIs. And then we couldn't do anything about it. So prior to 2006, if you had that problem, you had a scare, we had to send you to a psychiatrist and say, you're crazy, you are faking your symptoms. And I have a lot of patients sitting in front of me and say, please tell me there's something wrong, because I know there's something wrong, but no one can pick it up. And sometimes even the MRI doesn't pick it up, and then we do a diagnostic and therapeutic operation, and we find the problems there, because not everything is on pictures. It's a functional problem.